On June 3, 2024, a cyber attack crossed a line we never thought we'd see. In a London hospital, digital crime claimed a human life. This story begins with a company you've never heard of. It ends with over 10,000 canceled medical appointments, 1,700 postponed surgeries, and a death that could have been prevented by clicking a single security setting. This isn't about lost data or money. This is about a digital weapon aimed at the most vulnerable among us. I'm Mary from EasyDigitalSafety, and today we're uncovering how a 5-minute security fix could have saved a life. At the center of this tragedy is Synnovis, a name that means nothing to most people but everything to 6.4 million patients across southeast London. Synnovis processes blood tests for Guy's Hospital, St. Thomas's, King's College Hospital, and the Royal Brompton. When your doctor needs to know if chemotherapy is working, if you're healthy enough for surgery, or what infection is attacking your body, they're waiting for results from Synnovis. They were the diagnostic heartbeat of London's healthcare system, one critical link in a chain holding millions of lives in balance, and a Russian ransomware group called Qilin knew exactly how to stop that heartbeat. When investigators examined the breach, what they found was devastating in its simplicity. The attack succeeded because of one missing security feature that should have taken 5 minutes to enable. The Qilin hackers found an admin portal into Synnovis's network with no two-factor authentication. Imagine your house with a lock on the front door but no deadbolt. The hackers had a stolen password, their key, and because there was no second security check, no code sent to a phone, they simply unlocked the door and walked in. They didn't break in. They logged in. This simple oversight gave them complete access to London's most sensitive medical data. Once inside, Qilin executed a brutal 2-phase attack. First came the theft. They stole 400 gigabytes of the most private information humans have: HIV status, cancer diagnoses, genetic data, blood chemistry, all linked to names, birth dates, and NHS numbers. Nearly 1 million patients' most intimate medical secrets. Then came the digital poison. Ransomware spread like a virus through every system Synnovis relied on. The machines analyzing blood samples went dark. Result databases locked up. Communication systems died. In minutes, the diagnostic heart of London stopped beating. The real-world impact was immediate and catastrophic. With no blood testing capability, hospitals declared a critical incident. Over 10,000 patient appointments vanished from schedules. More than 1,700 operations, cancer surgeries, organ transplants, life-saving procedures, postponed indefinitely. Imagine preparing for surgery that could save your life only to be told it's canceled because hackers broke a computer system you never knew existed. Then came the ransom demand. $50 million. Pay up or Qilin would dump all 400 gigabytes of patient data onto the dark web for criminals worldwide to exploit. The NHS faced an impossible choice: pay terrorists or protect patient privacy. They chose principle over pressure and refused the ransom. Qilin made good on their threat. They published the medical records of nearly 1 million people online, a massive violation of patient privacy. Cancer diagnoses, mental health records, HIV status, all exposed to the world. But the worst revelation was still coming. An internal NHS investigation uncovered the true human toll. 170 patients directly harmed by the attack. For some, that harm was severe and permanent. And then came the confirmation of our worst fears. The investigation concluded that the cyberattack was directly linked to the death of at least one patient whose critical blood test results were fatally delayed. For the first time in history, a clear line connected a ransomware attack to the loss of human life. This wasn't cybercrime anymore. This was medical terrorism, using digital weapons against the most vulnerable people in our society. A simple security feature, taking 5 minutes to enable, could have prevented this entire tragedy. Instead, its absence created a cascade of suffering that ended in death. It took Synnovis 5 months to rebuild their systems. The trust broken may never fully heal. But from this tragedy comes a lesson we cannot ignore. Cybersecurity in healthcare isn't an IT issue, it's a patient safety issue. It's as critical as sterilizing surgical instruments or checking patient allergies. When we fail to protect our digital infrastructure, we fail to protect human lives. The Synnovis attack proves that in our connected world, a missing security setting can be as lethal as a scalpel left inside a patient. We must see the human faces behind every data point and understand that digital security is literally a matter of life and death. If this story has opened your eyes to how cybersecurity touches every aspect of our lives, subscribe to EasyDigitalSafety. Because understanding these threats is the first step toward demanding a safer world for all of us.